spend hours staring at a computer screen, but if you're a woman in your 40s and 50s, you could be doing a lot of damage to your eyes. Heather Urix is in, and Heather, it actually has a name. It's known as computer vision syndrome.
That's right, Linda. Optometrists believe many of us are suffering needlessly from it because we just don't know what to do. Hours of Celine Becker's days are spent just like this, eyes locked on a screen of important information.
It's been almost about a year ago that I started noticing problems. It was for distance as well, and I noticed that I was straining with the computer.
What she was experiencing was a common eye condition optometrists call computer vision syndrome.
Our eyes, from a natural perspective, are designed to look in the distance and occasionally look up close. So when we're at a close focal distance for extended periods, you get things like blurry vision, double vision, you can get headaches, red eyes, and a whole host of symptoms.
A Leger marketing survey found that Canadian baby boomers spend an average of 7.5 hours looking at screens daily. But women in their 40s and 50s are most vulnerable to CVS because the hormonal changes linked to menopause often create dry eyes, making a day at work very uncomfortable.
Headaches and, you know, my eyes felt strained, and I just knew there was something wrong.
Is that comfortable for you there?
Mm-hmm.
It's what brought Celine to the eye doctor. Treatment, she found, was simple.
The first thing that we tell all of our patients is to take breaks. That we have something called the 20-20-20 rule, which is for every 20 minutes of computer work or near work, take a 20-second break and look at something 20 feet away.
Celine also adjusted her workspace. She has a bigger screen and makes a point to sit back further. A year later, her symptoms have almost disappeared, though she knows that sooner or later, her changing eyes will require a little more help.
And I know eventually I will end up having to have bifocals in order to be able to see the screen properly.
Well, just when you thought the whole debate around flu shots could not get any more confusing,
Okay, we're back. Hey, you've probably felt this a time or two in our dry climate, burning dry eyes. Tonight, though, a word of caution before you reach for those eye drops.
Yeah, as Heather Urix reports, you've probably all felt it. It's pretty dry here, but unfortunately not all eye drops are created equal, and some can do more harm than actual good.
dry eyes have been making days behind the computer hard to handle for Stacey Craig.
They just get dry and itchy and irritated.
20% of Canadians suffer from dry eyes, but that number rises here in southern Alberta, especially in the winter time.
Depending on the type of dry eye, there are different types of treatment, different types of things that we would use.
In extreme cases, optometrists will actually insert plugs into the eye's tear drainage ducts to keep the eyes moist. But for most sufferers, eye drops are the best form of treatment, provided you choose the right kind.
Certainly, I mean, you don't want to go to the drugstore and grab the nearest eye drop because a lot of them are targeting different types of dry eye.
And there are some eye drops that could do more harm than good.
Anything that gets the redness out generally will target the blood vessels and constrict them, and that actually will make dry eyes worse. It also develops a chemical dependency.
As well, Dr. Ahmed recommends eye drops that are either preservative-free or have a disappearing preservative. Otherwise, you can risk cornea damage. Ultimately, an optometrist can help you decide what drop is best for you, or in Stacey's case, if it's time to try something new.
Overall, it was very mild, and now I can't even feel them. I'd say overall, very worth it. Should have nice and moist eyes.
Heather Urix, Global News.
Now, a few dietary changes can also help with dry eyes. It's also important to keep properly hydrated.